Dr. Davidhizar, I have a special question, which maybe is a little bit out of what you on a daily basis do, and that is gum disease. It looks like that a tremendous amount of people have gum disease, and yet they really don't do all that much about it. And in fact, even many dentists keep saying that gum disease, the problem with it is that you're going to lose your teeth at the end. And while this is a bad thing, because it costs money to redo them and it's uncomfortable to go to the dentist, at least today dentistry is in such a great shape that it can be done. The teeth can be with implants literally like the original one. But where I see the problem is that while you lose your teeth, 2, 3, 6 years, whatever it takes, you having an infection right at the gateway of your mouth, and that yellow, reddish, ugly pus which you have in there keeps dripping into your blood, ruining your liver, ruining your kidney, ruining your immune system. Obviously, it's apparently proven that heart attacks and strokes come from it. What is your take on this?
Well, I agree. There's been some recent research that shows that when you have chronic gum disease or even a small abscess, it really affects your whole body in lots of ways we didn't really anticipate before. The rate of vascular disease problems goes way up in those circumstances. So there's multiple other problems that occur, like you mentioned. So it's really important that people get good care of their gums, not just for their teeth, but for the rest of their body too. You know, in my practice, I frequently see people come in who are complaining about other problems, and I examine their mouth, and they have gum disease. They didn't complain about it. When I touch it with my tongue blade, they say, oh yeah, that hurts, and it bleeds usually. So frequently I'll just put them on antibiotics, tell them to see their dentist. But then I try to impress upon them the fact that they need to, take good care of their teeth, floss their teeth regularly, and see their dentist regularly. Because if we do that, we can prevent a lot of problems. Plus, prevention is always the best treatment. And if they see their dentist regularly, we can stop a lot of these problems before they ever start. But some people, I guess they don't like seeing dentists because they're worried about getting a shot or something. But, the downside of that is if you don't, you're going to have a lot more treatment and a lot more expense if you don't take care of yourself. And plus a lot of other problems with the rest of your health, like you mentioned. Lots of other diseases happen because of these chronic infections in your body.
Right. Like, for instance, I have heard that women who are pregnant and you are an OBGYN and you have delivered babies and then obviously taking care of their moms. So tell me whether you have noticed that or heard about it, at least by statistics. We're talking statistics here. Who have gum disease are prone to have premature births and get underweight babies. Any data you have on that?
Yeah, that's true. That's been shown in a couple of studies. It's not really well recognized yet, I don't believe, but I think it's becoming more and more recognized that that's the case. Anytime you have a chronic infection that spreads throughout your body, everything's at risk. Unborn babies, your immune system, your heart, your lungs, all those things can be a problem. So it's really important to make sure you take good care of your gums and your teeth.
Right. And like another study was done in Japan in some university, and a person who has HIV virus is, because of having gum disease, simply because apparently if a person has gum disease, the immune system is lowered, is more likely to turn the HIV virus into AIDS. Now, obviously, thanks God, very few people have the HIV virus in the first place. But if you can do something so drastic, what about the next flu season because you have gum disease? Wouldn't that affect you quite a bit more?
Yeah, sure. Anytime your immune system is affected, you're more susceptible to all sorts of other diseases and illness, especially, contagious diseases.
Okay. Well, here we have it. So basically, the mouth is not a separate entity from the body. It actually works in synergy with the body as much as any other body part.
Yes.
All right. Thanks for your information, and thanks, for giving us candid what healthcare is all about. Bye-bye, Dr. Davidhizar.
You're welcome.